great communications guru said something to me that I thought about my 6 years in and around the online health space. And he said, it never ceases to surprise me. Common sense just isn't that common. Now, the common sense of our worlds, the worlds of health, seems pretty clear to me. Everyone is a health seeker. Everyone wants, and now through technology can have at their fingertips, greater control of their lives. That same technology, offering easy information on our terms, we can share and extend to our specific conditions as a group, anonymously, one-on-one, whatever we want. It is almost as if this technology was invented for health. And yet, in my journey, I've had 5 stunning surprises. These will sound naive, perhaps, to some of you, but nonetheless, first, no matter how central health is for all of us, we as humans really, in the end, wish to avoid it. I should not have been that surprised. It was prophesied the day we formed HealthCentral. I received a phone call from a friend and top executive at WebMD who said, "Fantastic. Welcome to the space where nobody wants to visit your website." Based on the common sense I just mentioned, I thought he was crazy. What is more important than our taking control of our health lives, and in dire circumstances, getting all the information we can, and find people who have been there in order to commiserate it? Then I came to an understanding of the word compliance. This is a terrible word. I'm going to come back to this. I hate this word. But in effect, I was shocked to learn how many people, not just with chronic conditions, but with terminal illnesses, not only take drug holidays, but stop their treatment outright. We've all experienced this. We've all seen it. Lo and behold, they often act the same way visiting health websites. We all have that voice inside us that tells us constantly to watch our health or to do certain things if we or someone we love are in the midst of a battle. But another voice tells us not to define ourselves by it. It's not that bad. It's not me. I'm doing fine. I will just will life as I've always known it. Second, for all the talk of empowerment, it is really shocking how much has been beaten into our DNA that health decisions are made by someone else. Your company chooses your insurer, assuming they offer any. The insurer pushes you towards a doctor, assuming they take it. Doctors pushes your course of action after a 12-minute consultation, assuming you'll do what they say. I exaggerate here, but not by much. I remember not too long ago, I met with the former secretary of Health and Human Services, Mike Levitt. He told me how he once tried to price shop, apples to apples, a colonoscopy within a few miles of his home. And first and foremost, it was almost impossible for him to do it. He just couldn't find the numbers that added up. Finally, when he did, and he got a rough approximation over a few hospitals, he found a range from a few $100s to literally many thousands. And I felt his pain just a year ago when I received a check in the mail from my insurance company for $35. $35. Now, I have no freaking idea what this check was. And the description, which was some code, did not illuminate anything and left me with little condolence. Now, my mom raised a pretty honest kid. My first inclination was to call it. Might be a mistake. I should send it back. Then I began to wonder, wow, maybe they owe me more money. And at one point, I just said, screw it, and I cashed it. These stories underscore that the most common sense ways of empowerment is to know what you are getting and what it costs. But this dynamic, beyond a copay and out-of-pocket deductibles, simply does not exist in health. And this highlights my third surprise. Never in the history of business has there been such a massive industry, and industries whose companies affect every life, right? Not some lives, every life, that has as their competitive advantage complete mastering of obfuscation. Now look, others give a run for the money. Any of you who have spent an hour trying to fathom the 40 pages of papers in your mortgage refinancing knows what I'm talking about. But I got to tell you, man, health is in a league of its own, and the stakes could not be any higher. Fourth, so many parts of the healthcare industry. Well, I'm not talking about some of these wonderful, heroic saints that we all have experiences with doctors and nurses and other health practitioners. But overall, as an industry, it is as if they have almost forgotten about the patient. It's just amazing to me. It's like the patient is lost. You see it in the choice of words. And this brings me back to what I said before about these terrible chestnuts, compliance and adherence. Important concepts. It's just the words that I really don't like. It makes me feel like I'm a pet dog. If If you read the backs of any pharma magazine ad, you wonder if the regulators who compel it had ever been sick a day in their lives. I have met with dozens of Twitterers in pharmaceutical, insurance, hospital, and other companies, and I asked them a very simple question, a kind of rush-hour test of whether or not maybe they've lost the patient. And I asked them, would you, if you no longer work at this company, follow you? Not one of them said yes. That tells me a lot. I don't get it. After all, every person in the health system is, has been, or will be a patient. Why is it so hard to be the patient that we seek? But there you have it. So, we are, at one level, resistant to engage in health. So much of the decision-making is in other hands anyhow. The entire industry seems to be based on compounded obfuscation, and the patient gets lost. And this leads me to my final surprise. Where are the pitchforks and torches? Where are the pitchforks and torches? Where is the we are mad as hell and we're not going to take it anymore? I'm from Washington, D.C. I've been here for a while. I actually worked in government for a while. I used to argue that real healthcare reform will not happen until we all stand up, not allow the forces of obfuscation to win. We, after all, are everyone. Don't we outnumber them? Being in the online health world, though, seeing in the condition-specific communities and shared stories, that is the backbone of HealthCentral.com. Spending time over the years getting to know so many of you, I began to realize that my question was both an old way of thinking and counterproductive in any event. While I wring my hands about the nonsense masked as common sense, you all are standing up quietly and deliberately and taking action regardless of the obstacles. Whether driven by anger or invention, who cares? It doesn't matter. We rage at unconquerable, even unknowable gods, but to what end? Just do. This is the credo of entrepreneurship that has driven the technological revolutions we love generally. There are always more obstacles, more reasons why things can't be done. The women and men of impact simply saying, fine, you worry about that, I am going to act. You are running a more quiet revolution in our midst, empowered by technology, effectively end-running powers of obfuscation. You are, I will suggest, patient entrepreneurs. You are patient entrepreneurs. Many of us were proven wrong that with great technology would change health and wellness overnight. At the same time, the arc of behavior bends towards whether something makes our lives better, cheaper, faster, more beautiful, more fulfilling, more inspired than it was before. This is the ultimate criteria, the ultimate common sense of any successful innovation or product. For all the talk of great technology around patient health records, mobile tools, apps, fantastic new attempts to help us price compare, or at least better understand our reimbursements, some outstanding businesses, others nifty gadgets, a few lead balloons, this really doesn't matter. They, and more like them, will happen. It is not a matter of whether, but of when. The rudder for health in the future is what the people in this room, you guys all represent. Patient entrepreneurship is based upon true patient empowerment and the transparency, community, and action that it commands. Patient empowerment is a terribly tossed around word, but at its essence it means the three most important needs we all have. You know this. We all have, in a time of health, part and parcel, often as important as the treatment itself. And these needs are, I am not alone, I am not crazy, and I can take actions at work because I have seen, shared, connected with, been rallied by people like me who have done the same. I'm not alone, I'm not crazy. I can take actions at work because I've seen, shared, connected with, been rallied by people like me who've done the same. It's this last one in particular that to me is truly revolutionary. What is real, not hype, but real patient empowerment. I know I can take control or act in a certain way because someone like me did it and they worked, they succeeded. Again, this is so important. It's just not about the condition or an abstract sense of what we're going through. It's about me. It's about you. It's about us, very individually. And this to me has been one of the great epiphanies that I've had working at HealthCentral, because you see it all the time in the stories that people share. A 32-year-old woman, a mother of two, who's been diagnosed with breast cancer. It's not that she doesn't care what a 65-year-old survivor has been through, because she does, but she really cares about finding other 32-year-old women with young children, with well-intended, pain-in-the-asses husbands, and having to live a day-to-day life at their job or at home. those kinds of specificities and sharing this in the individual context is so powerful. An ADD adolescent who thinks he's a loser, a depressed husband who doesn't know how to answer his wife's constant nagging about, what are you depressed about? A 55-year-old man asking, should I put my dad in a nursing home? These are the profound, unique, contextual concepts where people in the end aren't being nagged, they're not being bothered, but people need to understand the different kind of context that really in the end are so powerful when people who have been there are sharing those experiences from similar contexts. In your blogs, in your support, in your tools, in your sharing experience lies the first steps of control. We all learn that others just like us regularly fire a doctor, get a second opinion, come back from a drug holiday, talk to a boss about health needs, learn how to tell their children about what we are going through, try a new course of treatment, and on and on and on. Shared stories, shared aggregate data of what works and what doesn't, shared recommendations, all equal better outcomes and greater individual control. This is what will lead to adoption. No, I suggest demand for the technological innovations that will change the system and get more control into the hands of all of us who need it so greatly. That is what will drive broader structural change, because anyone who cannot stand up to the light shown upon them, the transparency these worlds require, will eventually fall. Look, it's not going to happen overnight, but it's happening steadily, and it's happening because of you. That is common sense. Thank you. And then I'll come back to that. I'm just sort of curious because it actually ties to your question of all. I don't want to get too much into the Obamacare thing. I side very much with some of his outlooks to it, and I think there are a lot of long, significant poll conferences around why things have played out the way that it has overall. But yours is just an unbelievable story. As an entrepreneur, it's heroic. But what you've done here in healthcare is really unusual, and a lot of businesses don't jump to the kind of common sense that you've created here. So I'm curious, in the experience of what you've built, I mean, do you feel like you've got something here that any business can come in, take literally the plane that you have and have a third of the cost in healthcare? Have you learned in any of the bumps that comes with life that there's some things that certain industries, certain businesses will not be able to adopt it? Or do you really believe you've got something that's wrapped in a bow that businesses have to replicate quite effectively?
Well, yes, I think it won't be replicated. But I think that there's almost sort of a perfect storm scenario. In our situation, we have 7 hotels, all in Orlando. All of our associates and dependents live there and have easy access to our facility. So if you're a company that is scattered throughout a city or a state or the United States, it makes it a little bit more difficult. But what you can do, and we've encouraged others to do this, join forces with some of your colleagues. So if you have 200 covered lives, and I think 1,000 covered lives is really the minimum. If you have 100 covered lives and you've got a buddy down the street who's running a furniture facility and he has 100 and somebody else has 500, get together. Dear God, you drive down any city street tragically in the United States for lease, for lease, for lease, for rent, for rent, for rent, for sale, for sale, for sale. Creating a little primary care facility for that entity won't be very difficult at all. And if you have a healthy group, much healthier than mine, I do believe that if you follow our template, and we'd be happy to sit down and discuss that with anyone, if you follow our template, your cost could be somewhere between $1,000 and $3,000 quite easily. And then your associates would share in some of that cost, and you'd have a wonderful plan, and Uncle Sam would say, you know what, the folks are being covered, that's what we wanted, and we'll step aside.
Really, to the essence of your question, in a lot of respects, you step back and you say to yourself, we have an intent that everyone should have wellness and health. Right. Both, by the way. Again, his first observation to me, which is so profound, is it's not about once you get sick what to do with it. Right. He obviously does that in very creative ways. But it's so much about what can we do to have it preventative, because everybody wins overarchingly. And so I believe that this administration, despite what you see on TV right now, actually comes at this in a lot of well-intent around similar theses. But the question that I have to ask is, do you think there's a better chance for the kind of innovation that you've heard about today to come from people like this, or do you believe it's going to come from massive one-size-fits-all mandates around the country? And I think historic evidence proves what the answer is. Right. That's all.